Okay, all right. Another episode of reading. Uh, we are going out of phmpt.org, or the Public Health and Medical Professionals for Transparency. Their documents. This is in the Pfizer's documents. This is in 5.3.6 post-marketing experience. In that PDF, it is on page 30. We have Appendix 1, list of adverse events of special interest. We have acute febrile neutrophilic dermatosis. Acute febrile neutrophilic dermatosis. Pretty close. I think I'm saying that one right. The neutrophilic could be different. Febrile. Acute febrile neutrophilic dermatosis. Let's look it up. rarediseases.info.nih.gov. It's where we've been most of the time. It's where they tell you about all the rare diseases. Rare diseases. These are all rare. Okay, other names: Sweet syndrome, or SS, neutrophilic dermatosis, acute febrile, acute febrile, or gum button disease. Gum button disease. All right, we're just going to read the summary. Acute febrile neutrophilic dermatosis is a skin condition characterized by fever, inflammation of the joints, arthritis, and painful skin lesions that appear mainly on the face, neck, back, and arms. Although middle-aged women are most likely to develop this condition, it may also affect men, older adults, and even infants. The exact cause of acute febrile neutrophilic dermatosis often isn't known. It is suspected that it can be a reaction of the body to certain exposures, sun, infections, streptococcus bacteria, or medications. Azathioprine or non-steroidal anti-inflammatory medications. This condition can also occur with some types of cancer and other serious health problems. Most often, it isn't serious and will clear on its own in a few months. Healing is much more rapid, however, with treatment such as corticosteroid use. All right, so it's a skin condition characterized by fever, inflammation of the joints, and painful skin lesions that appear mainly on the face, back, neck, and arms. Face, neck, back, and arms. That's what I said. I'm going to look up gum button disease. That sounds like something I've heard of before. It's obviously supposed to be talking about the same thing. So we'll just see if the results are the same. I'm pretty sure they will be. Rare, benign. Let's do we got PubMed, NIH.gov again. So we'll just stay in this family. Acute febrile neutrophilic dermatosis, AFND, also known as sweet syndrome or gum button disease, consists of erythematous plaques and papules, along with constitutional symptoms such as fever and malaise. The average age of onset is 30 to 60 years, and there is a female predominance. The disease is characterized histologically by a dense neutrophilic infiltrate. It is associated with several underlying diseases, including infections, malignancies, inflammatory bowel disease, autoimmune disorders, pregnancy, and drugs. Clinically, the cutaneous lesions present as tender edematous, erythematous plaques and papules, which may occasionally be bullous. The most effective treatment is prednisone. Other potential All right, we had to restart it. The most effective treatment is prednisone. Other potential treatments include dapazone, colchicine, and potassium iodide. Yeah, I'm not really trying to give you any advice. That's not advice for me. But this is from NIH.gov, and I'm just looking to define things. So, acute febrile neutrophilic dermatosis (AFND), also known as sweet syndrome or gallbladder disease, consists of erythematous plaques and papules, along with constitutional symptoms such as fever and malaise. That's the definition of acute febrile neutrophilic dermatosis. This is from the list of adverse events of special interest. This is the end of that video.